Hello, everyone. Welcome to Facebook Live. I'm Dr. Annette Mercatante from the Clair County Health Department, and this is our weekly COVID Facebook Live session. So you can type your questions in and ask us what's on your mind. We will get started right off with our COVID update with our numbers. And and I'm echoing. So here's our COVID numbers cumulative from the start of the pandemic in March of 2020, and then the changes in the last 7 days. So as you can see, we've had over 600 deaths total, and in the past week, we've had unfortunately over 30 more deaths. So that is ticking upwards a little bit at this time as our numbers continue to be pretty high, over close to 1,000 new cases every week. Next slide. And then this is our epi curve, which is pretty telling, right? So, as I've been mentioning earlier, a real unusual curve. We've been steadily increasing now for months, kind of appear to have hit a plateau. We've come down a small amount, but now we're kind of staying in this high transmission rate. And this is a pretty substantial amount of transmission. As I mentioned, close to 1,000 cases a week that we're aware of. And as I've mentioned many times, the number of cases we're aware of are certainly smaller than the total number of cases that are out there. So it will remain to be seen if we're starting out from this level of transmission, if we start experiencing the Omicron transmission, what that's going to look like. Next slide. And this is our vaccination data. As you can see, we continue to have kind of a 50% vaccination rate. Although the next slide I think is a little more interesting, probably the good news. We're all about good news. And that lower, darker blue segment shows that we've had over 500 first-time vaccinations, first doses, which means people are still changing gear and making that decision to get vaccinated, which is continues to be your very best uh, choice for remaining out of the hospital and not having severe disease. That continues to be true even now with the variants. Next slide. And then, as always, you can go to our data dashboard. We update this daily. There is also in our media section the Friday data that goes out that includes the data that we put here on Facebook Live, so you can see the weekly summaries. And I think most of the time that covers the vast majority of questions. And if not, there is a FAQ section on our website as well that covers many of the questions that come up repeatedly that we try and answer in one place so that everyone can find them. So please look at our website. You'll find a lot of good information there. All right, so let's get right to the questions. My talking points today are just to remind you that for testing here in our health department, we'd like you to make an appointment before arriving. You pull into one of the numbered spots in front of the building, and then you call the number on the sign for further instructions. We do want to remind everybody that we only want people to show up and test while we're here open for business. If you drop a sample off after business hours, it will sit there and not get run. Okay, so it's not going to do any good. So and please don't take any test kits home with you. We will try to accommodate your needs, but if you're after hours and need a test, your best bet is to find an alternative source for that. So when should someone test? Obviously, if you're feeling ill and you want to know the difference between whether you have COVID or the flu or something else, our tests are just for COVID, but COVID testing helps a lot. At least it takes you off that isolation list. And then obviously, if you've had an exposure, anytime you're feeling ill, vaccinated or not, by the way, you should be tested. If you've had an exposure, it's reasonable to get tested about 3 to 5 to 7 days into that exposure. That can be very reassuring. And I'll add a third one, and that is right now, as we're looking at facing another surge from this variant, and we are looking at getting together with our loved ones in our homes, it's not unreasonable to get a COVID test, especially before you're getting together with multiple families or multiple groups of people, particularly if some of them are unvaccinated, and that makes them much more vulnerable. So lots of reasons to get tested, and hopefully that is not going to become a scarce resource. The government is talking about boosting up our or our testing capacity, and I do hope that that will be the case. So let's get to our questions. I think Nancy. Oh, by the way, this is Nancy Deasing. She's filling in for uh, uh, Jennifer while she's gone. So, hi, Nancy. Nice to see you.
Hello. Hi.
Generally, Jen reads those questions to me and then I answer them. So, and then
Okay, great.
what comes in. Mhm.
All right. Israel has been issuing the second booster after 4 months from the first booster for 60 plus. Is the US going to implement this? Also, the chance to reduce isolation time.
Yeah, I mean, Israel and many European and countries throughout the world are doing all kinds of things. At this time, I have not heard any rumbling or discussion about a fourth booster shot. So it's not clear whether that will be on the table or not. But obviously, as more data comes in and we focus on some of those issues, that may or may not be the case. But so far, I'm not hearing anything about a fourth booster. And as far as isolation times, I'm also hearing a little bit of discussion that in the literature, but I have not heard anything coming out of the CDC or NIH or the Michigan Department of Health and Human Services suggesting there'll be a reduction in isolation times at this point in time. So, isolation times, which is the time you want to separate yourself from other people while you're ill, is still 10 days from the onset of your symptoms, or if you're not having any symptoms, it would be 10 days from the time that you took your test. And there would be no test out option for that at this point in time.
Okay. Question number 2 is, have I been vaccinated with the J&J shot and then had COVID at the beginning of November? Should I still get a booster? And if so, when should I get it?
So you want to get a booster. Um, if you are, well, you have the J&J, so you'd have to be at least 2 months outside of your J&J vaccine. And as far as after recovery, as long as you've recovered from your COVID infection and you're out of isolation and you're feeling better, you can get your booster shot. And the answer is yes, you should get your booster shot because we believe that booster shots are going to provide extra protection against the omicron variant. So that's really been the push with the booster. Particularly though, if you're high risk, we do want you to get boosted. And then when it comes to well, okay, that was a question. I won't complicate it anymore. Go ahead.
Thank you, Doc. Okay, question 3. I'm concerned many people who test positive at home or or get a PCR COVID test don't have info about what qualifies for the monoclonal treatment.
Yeah, the monoclonal antibody treatment is something you need to consider if you've tested positive. It is not available to everyone. You have to have eligibility criteria. And the best way of knowing if you're eligible is to call your healthcare provider. If you don't have a healthcare provider, you can call us and we'll walk you through that as well. And I'll just say that the priorities are fairly straightforward to consider. If you have a positive COVID test, first of all, you have to have some symptoms, okay? And they have to be for less than 10 days. So you don't benefit from monoclonal after 10 days. You have to have a positive test. We talked about that. You can't be sick enough to require oxygen or be thinking about going to the hospital. So your symptoms need to be mild enough where you don't feel you need that. And then for you also have to have one of the following. You have to be have a BMI, a body mass index of over 35 that qualifies you as obesity. You have to be over the age of 65. Now, it'd be one of these. You can have multiple, but you need at least one of these. You have to be over the age of 65. You have to have a chronic respiratory disease like COPD or severe asthma. If you're on any kind of kidney dialysis or kidney treatment, like hemodialysis or peritoneal dialysis, if you're pregnant, or if you have any immunosuppressive type of illness that would warrant you higher risk. So those are the priority areas. You can also be considered if you have diabetes, cardiovascular disease, other chronic kidney disease, and of course, there's some criteria for pediatric patients as well, between the ages of 12 and 17. So again, it's really up to your healthcare provider or someone who's familiar with these criteria to walk through this with you, and I would just urge you to think about it if you've tested positive and you know you have some medical conditions. So it should also be, do we have anything like this on our website, Nancy? I'm sorry. Is this on our FAQ? The monoclonal, I believe we put
Yes.
our monoclonal information there as well. So you could go to our website at scchealth.co and also find this information there as well.
What do our local doctors tell or educate people about this treatment if exposed to someone with COVID?
What do our local doctors tell or educate? Well, I guess that would be up to your local doctor. I'm assuming that our local doctors consider your eligibility, your risk, and whether or not you would benefit from it. And if you would, they write an order for it and send you on your way. So all three of our hospitals are providing monoclonal, and as you know, we have a community infusion center now 2 days a week. But also requires a doctor's order. So the first step is to find that doctor's order either with your own physician or give us a call here at the health department and talk to one of our nurses, so that we can kind of triage you and see if you're qualified or not.
So, another one related to the same topic. Are these situations that vaccinated or unvaccinated people get the treatment if exposed to somebody with COVID?
So, anyone who's positive for COVID, vaccinated or unvaccinated, is eligible for a monoclonal treatment. Okay. However, if you're not ill and you're not positive, but you've had an exposure and you're high risk, there are criteria for what we those are called post-exposure prophylaxis, and there are some criteria for some of the monoclonals to use in those situations. And again, that would have to be discussed with your provider or with us. And I can tell you with some of the changes with the Omicron virus and the availability of these products, some of the post exposures are going to be limited to people who have very high risk, who are immunocompromised. So again, it would have to be discussed on a case by case basis. But if you have a very high risk, and the main ones that they talk about are really immunocompromised things, immunodeficiencies, getting chemotherapy, being a bone marrow transplant patient, or having kind of an autoimmune disease that's having requiring ongoing immunosuppressive therapy. All of those things should prompt you to have a discussion with your doctor after a high risk exposure to see if you'd benefit from a monoclonal treatment. But primarily, the monoclonal treatments are recommended for people who have tested positive, irrelevant of their vaccination status. So now I
Okay.
guess we go to our questions if there's any coming in.
There are. We have about 12.
Wow.
And so they're still coming in. So we'll address the first one. It's from Penny.
Hmm.
Penny asked, is there any news as to when the children's ages 11 to 15 will be able to get their boosters?
I'm going to have to research that a little bit more. I can tell you there's nothing on my radar right now. I'm sure it's being discussed and debated by the ACIP, but we'll have to get back to you. Send that question, please, to our COVID-19 email address, COVID-19 at stclaircounty.org, and we'll make sure we respond to that. As far as I know, it's not on our immediate radar, but I don't want to speak before checking into it a little further. Thanks for the question.
Okay, our second question is from Michelle. If you originally received the J&J vaccine, can you start a Pfizer or Moderna series, or which booster would be most beneficial?
Right now, the recommendation is to get an mRNA booster, either a Moderna or a Pfizer. Whether or not you'd benefit from a second dose is still being out there and discussed. But right now, if you received a J&J, I would recommend you get an mRNA booster. They seem to be working better.
Okay. Question from Bonnie. If someone that is not vaccinated just recovered at home from COVID, when should they get the vaccine? Now or 3 months?
Well, given everything that's coming down the pipeline, I'd say as soon as possible. Now, it, generally speaking, you can get your vaccine as long as you've recovered from COVID. That's, as we mentioned, that's 10 days out of isolation, and that in general, your symptoms are improved or gone. Okay, so it's whenever that may be. So, certainly well before 3 months. The other side of that coin is that we do believe that reinfection rates in that first 90 days are rare, but that picture is starting to change, right? After now that Omicron's coming around, so I would err on the side of caution and get it as soon as a person's recovered. Um, at this point, I think that would be the more prudent approach.
Okay, question from Heidi. My cousin got COVID and she just got the antibodies IV treatment today. When she gets better, how long should she wait until she get her first vaccination?
So she needs to wait 90 days. If you receive monoclonal antibody therapy through an IV infusion or through the sub-Q route, they are estimating that that's going to linger in your body for a while and would interfere with the vaccine's effectiveness. So they're using a 90-day time frame for anybody who's received monoclonal antibody therapy to get to get a COVID vaccine. Okay, a specific to COVID vaccine. Now, that's not as bad as it sounds, because as I just mentioned earlier, there's generally a strong belief, I guess, we don't know exactly how long immunity lasts after natural infection, but there's a strong belief that in the first 90 days you have pretty good coverage. So under the circumstances, those people are going to have to kind of play it a little bit more careful for those first 90 days until they can get vaccinated. But that person would have to wait.
Okay. Next question from Angela. And this kind of had a second part from another viewer, Angela. So her question is, so with breakouts at long-term care facilities, what should happen to stop the spread? And then the other viewer, Julie's question was regarding, well, what are the sites for long-term care that are having issues?
Oh, well, we're not going to call out sites. Although I do think there's an outbreak indicator on MDHHS's website. I don't know if they still have that up there. And I honestly, I don't have that in front of me, but we have many outbreaks, as you probably know, many outbreaks in many congregate settings. So what do you do about it? We already know what to do to stop transmission, right? So we isolate the person who's infected, or we cohort people who have positive COVID together away from the people who don't have COVID. We make sure the people caring for them have very adequate PPE and aren't transmitting it as from patient to patient. We do use monoclonal antibody therapy in those chronic in those congregate settings. That would be up to the medical director of that facility, but there's opportunities and ways of making arrangements to have widespread monoclonal therapy given. including post-exposure prophylaxis if it's a particularly high-risk situation. Um, what else do you do? You can consider temporarily restricting visitors and restricting the in and out uh, part of a facility so that the virus isn't spread that way. And of course, all the hand washing and the social distancing piece to make sure it's not inadvertently transferred with objects. So those are the approaches that people are taking. And quite honestly, typically, if there's real aggressive movement during an outbreak, they usually can put a stop to it if you're masking and making sure everyone's vaccinated and making sure everyone is staying apart. Those outbreaks can usually be pulled back in after a period of time.
Next question from Nikki. If you had the Moderna, is it better to stay with Moderna for your booster if you can?
That's a great question, Nikki. M- I'm not sure. I can say that it seems to be better to use an mRNA product for your booster. And most people who've had a primary series of one vaccine will stay with the other. I haven't seen any really compelling evidence to suggest that one is better than the other as a booster, regardless of what your primary series is. Um, I doubt it. I think you're going to be okay. On the other hand, if you know you've tolerated those two previous vaccines, it does make sense that you want to stay with what you know you received, right? I mean, that I know I received a primary series with Moderna, and I stayed with my Moderna for the booster just because I did all right with the Moderna. So that would be probably more, but I wouldn't base it on whether one would work better than the other. I don't think that there's enough evidence there to support that. But it makes sense to stay with what you knew you tolerated.
Okay, question from Terry. Family just got over COVID, not vaccinated. I'm vaccinated. Can I go to their home for Christmas?
Well, this goes back to that idea that this is probably the least likely time that they're going to infect anybody is immediately after they've recovered from a COVID infection. That again, that first 90 days, and certainly in the first 30 to 60 days, they have the strongest immunity, and it probably hasn't started waning yet. So, um, it's probably a pretty decent scenario, right? They're probably not reinfected this quickly, and you've been vaccinated, so I would say that's a pretty good situation.
Another question from Nikki. Are you testing to see how many are testing positive with the Omicron?
There is a protocol in place in Michigan on which samples are being tested. There is some random sampling going on, but also with certain outbreak situations. I forget the different criteria where we would send a sample up to the state. So not all specimens are being tested for Omicron, right? So it's going to be a situation where, as the Bureau of Labs at the state identifies the proportion of what they're doing as Omicron, as that changes, they will just tell us that the majority of the virus that we're experiencing in our state is now the Omicron variant. Honestly, we can expect that very soon, given the increase so rapidly. So it won't be any surprise. I was just asking that question today, or whether or not we'd had any formal notification of Omicron in our county, and I haven't actually had that. But we can assume that, given the state knows we have Omicron here, that we will see a very rapid development of it becoming the dominant strain, um, as is the case everywhere else in the country and the world.
Okay, next question from Sarah. Merry Christmas, Dr. Merc. Can you talk a little bit about the antiviral pill that was approved today, and any idea when that will be widely available?
No. Yes, I can talk about it, but I probably know about as much as everybody else at this point, other than the government, the federal and the state government appear eager to get as much of this out. So it could be as early as next week. I'll probably find out more in the coming days. The drug is called Paxlovid, Paxlovid from Pfizer. It is a combination of an antiviral that we use for HIV and a brand new antiviral. And you do need to take it within 5 days of your onset of symptoms for it to be effective. So there's going to be some limitations there of making sure you get the script. But doing that, the initial phase 2 and 3 trials indicated that it can reduce the risk of serious illness and hospitalization and death by 89% in high risk individuals. So there's a lot of caveats there as far as who will be able to get it and how well it'll impact people, but it does appear to be effective in high risk individuals, maybe even more so than our monoclonal antibody infusions. And obviously, taking pills is going to be a lot easier than trying to find someone to start an IV and give you an infusion. Um, and that's about all I know. 3 pills twice a day for 5 days. So it's a pretty easy thing. I think the hardest part is going to be the logistics of who gets it and how we get it to you and who does that process. And I just don't have that information just yet. But it's exciting, and it's going to be one more important tool that we have to keep people out of the hospital for sure. And I think the positive end of all of being in this thing now for 2 years, right? We're going into our third year, is that we're gaining more and more tools and more knowledge, and we are definitely seeing the impact on how many people are dying during each surge, and how many people are really getting negatively impacted. So that's a real positive thing.
And I'm sure definitely our next shows will
Mm,
feature that as we learn more as well.
absolutely.
Uh, Next question from Nancy. If your spouse has COVID, could you get vaccinated now?
You could. It's a trick question. So you are, if your spouse has COVID, it means you're exposed, right? You have a high risk exposure, and we would be asking you to quarantine for the 14 days, 10 at the least, 7 days with a negative test. All right. So all of those things. I'm assuming then that because you're unvaccinated, you absolutely should be quarantining. And we really ask people who are in quarantine not to come and get vaccinated, quite honestly, because it puts everybody at risk. It puts the vaccinators at risk, right? So we would prefer you to wait until your quarantine period is over. Um, so I guess that's the official right answer to say.
Okay. Next question, Wendy. If you've gotten exposed and you're supposed to test 5 to 7 days later, if it's negative, are you in the clear or do you still wait the 2 full weeks to be in the clear?
So you're not in the clear, but you can be reassured that you have a lot less like. So most people who have been exposed will convert, will start expressing, or the virus will start replicating and become positive in that 5 to 7 day window. But beyond that, it's still possible. And that's why we say up to 14 days later, you can still convert and become positive. So the 14 days is still solid. But after 7 days, if you're negative, you can take yourself out of the quarantine, do what you have to do. But we'd ask you to still remain very cautious on what you do until that 14 days is up, which means you wouldn't want to present yourself or be around high risk individuals, right? You wouldn't want to, you'd want to wear your mask all the time. You would immediately need to test again if you developed any symptoms. So you're not in the clear per se, but we do say that after a negative test at that time, that you can return to your daily activities with a certain amount of caution, right? So just keep in mind that you're not fully in the clear until those 14 days are over, because there is just a proportion of people who will continue to convert to a positive beyond that time, up to 14 days. So, and it's impossible to say who those people are going to be. So, we have no way of saying, oh, because you have these conditions, you're going to be fine after 7 days, and you need to wait. We just don't have that level of clinical management yet. So, kind of refers to that first question about reduction in isolation times. So we still just need to wait a little bit more for the science to give us a better understanding of that.
Okay. It's 4 o'clock right now. I have one, two, three questions, and then just one that is adding a kudos. Do you want to keep moving
Oh, of
along with those
course, of
questions?
course.
Okay.
Sure.
Okay. Um, this one is from Jennifer. Just a kudos to us regarding our website, saying it's helpful, providing all of the information. And so thank you for the compliment for sure. Next one is Nikki. Does the Omicron affect the lungs?
Well, of course, this is a respiratory virus. And as a respiratory virus, it can affect the bronchial cells, the lung cells, and it's really the lung cells that we worry the most about, because that's when you develop pneumonia, right? When the infection is in your alveoli or your lung cells. There are all kinds of discussions right now in the literature about whether the Omicron is more predisposed to the bronchial tubes, to the bronchial cells versus the lung cells, but I don't think that we have any um, clear knowledge of that just yet. So yes, Omicron can still cause pneumonia like the other coronavirus variants have. Whether it will in the same proportion or not is what we're still unsure of.
Next question from Gary. Where can we get rapid tests?
So that's a great question. It's the $24,000 question, because I do think testing is going to become more and more helpful, and I think it's a lot more convenient to pull out a test at home and do it before you go somewhere than seeking out a test through an appointment, right, in an urgent care or something like that. But there is a testing a link on our website where you can find the testing available by appointment here at CVS, urgent cares. There's all those available by appointment. And if you keep your eyes open, there's rapid antigen tests available in your pharmacies. We just picked some up at Walmart. I saw one at Rite Aid. They don't stick along around long, and please don't hoard them. But if you see them, pick up a kit. Most of the kits are about $20, and they have two different tests in them, and that's so that you can do one, at day 5, and then another one at day 7. The things that you need to kind of be a little bit more reassured. So right now, those are the only places I'm aware of, and I'm hoping that we'll see some expansion of that as well, where people can obtain kits a little more easily.
Okay. Next question from Kim. 9 people at my husband's work in the last 10 days have had COVID, not vaccinated. When can they come back to work as far as the quarantine and the symptoms?
So the isolation period for people who are ill or tested positive for COVID, meaning we are assuming that they have active virus replicating in their body, is 10 days. 10 days from the onset of their symptoms, or if they've just tested positive and really have never gotten sick, it would be 10 days from their test. Beyond that, we don't believe they have any real risk of transmitting that virus to other people. Now, the issue of quarantine gets a little murkier. We just did release a revised quarantine, so we're going to try and do quarantine the same for everybody. But the reality is, there's lots of options for quarantine. And that means you have an exposure, but your test is negative or you're not ill. And you have that 14-day period that we were just talking about where there is a risk that you may become infected. Um, from our data back in the day, it looked like about 25% of people exposed ended up getting COVID, so it's not 100%. And as you know, if you've been wearing a mask or you're vaccinated, you have a much lower risk of actually getting sick after exposure, but it's not a zero risk. So that quarantine period really depends on a lot of pieces in your life. If you have the ability to quarantine for 14 days, 10 days to 14 days, that's the easiest thing to do. But remember, that's from the last day of your exposure. If you're living with somebody with COVID, your quarantine period does not begin until the last day of their infectious period. We've gone over this a few times with this so if your husband has COVID and he's living with you and you're sharing a bathroom and a household, he is infectious for 10 days. You have a high risk exposure because you're living with this individual. Your quarantine period will begin at the end of his 10-day isolation period. And then you have that 10 to 14-day period where you should just really be very cautious about not going out shopping, always wearing your mask. And then you can shorten that up a little bit if you do some testing ahead of time. And if you do more testing, you can shorten it up more. The 7 days is kind of the more, it seems to be the easiest for most people. You can leave the house after 7 days if you've had a negative test at that point. And again, please refer to our website. We have we have a quarantine infographic that kind of walks through that, and it really varies a lot. So, what do you do for a living? Do you go to work and sit in a cubicle where you don't have a lot of people around you, or are you greeting population in a direct way where you're talking to them all the time? That would, I think, set up two different risk situations of how quickly you should leave your quarantine. And so you choose that. And then, of course, you need to talk to your employer and find out what your employer needs. And so there's a lot of variabilities as far as quarantine goes. But isolation right now is always the same. It's always 10 days. Okay.
Okay. Next question from Amanda. Oh,
Yeah,
let's
that's a great question. Oh, go
oh,
ahead and read it.
okay, sorry. It was slow at popping up. Will the definition of fully vaccinated change each time a new booster is released?
I don't know. Great question. I don't know. Right now, it is not. Fully vaccinated at this point means you've had a full primary series. You've had either one J&J or two of the mRNA vaccines. That still up, that still qualifies you as fully vaccinated. Whether we'll start including that you need a booster dose. I've read some things that shows that really a full primary series by all rights might be 3 doses. And if that's what they end up, because a lot of our vaccines, it's a 3-dose series to get to be fully vaccinated. So is that where we're going to go? Time will tell. The science will take us there eventually. So right now, we're just going to have to keep our minds open about that.
Okay, last two questions. One from Jenny. Are the tests accurate past the expiration date?
That's a good question. It depends on the test. So there have been extensions of some of our tests beyond the expiration date, but they're based on the lab that they came from and the expertise of what that lab tells us about the things that they use in the test. So I would say not automatically. Your chance of having a false negative would likely go up after an expiration date. Um, and so if you have an expired test, um, I wouldn't put as much uh, trust in it. but I do know that so we've had some tests that did have extensions of expiration dates, but it was only after we got specific approval from the lab and from the manufacturer itself that that was a valid thing to do. So it's not across the board.
And then the last question is from Cliff. Have the rules changed for companies to tell the people that you may have been exposed? I ask because a lot of businesses have been not telling people, and how long do they have to tell you?
As far as I'm aware, a business still needs to inform their employees if they've had an exposure. I believe that's still the case. Put that down. Nancy again will review the OSHA rules, but I believe they're still intact, although there was an expiration date on those OSHA rules, and it might be coming up. But yeah, and it's good practice. I would just say this: it's good practice for an employer to tell their employees when somebody has been exposed. They don't have to say who it was that got sick, but they can say you've had an exposure. They are also required. It is a disease, what we call a notifiable disease. They are required to tell us when they're aware of a positive case, and there's a simple jot form submission that they can do from our website as well, that they email that they send that to us. Those are things that are still out there. Yeah, I know that people aren't always doing it, but it's good practice. It's best practice because it helps keep people aware. When you have a known COVID, your behavior changes, right? This is why we think this darn thing runs in peaks. It's not because the virus just stops making people sick. It's because people's behavior changes during a surge. And so that behavior change is critical to get things back under control, which means we have to talk to each other. There's no shame, right, in getting COVID at this point. Everybody's potentially getting exposed. What's important is that we share that with the people that may have had an exposure so they can do the right thing.
And I know I said it was one last question, but this one I think is important because it's just talks about that timeline. So this one is from Alicia. So if you live in a household with someone who has COVID, fully vaccinated, my quarantine wouldn't start until after the 10 days of the
Well,
infected person.
okay. So the person who's ill is fully vaccinated. That's what I'm taking from this. And of course, it doesn't matter if you're vaccinated or not if you're ill. That person who has a positive COVID test needs to assume that they're infectious for 10 days. Okay. Now, the people that live with that individual at that point have a couple choices. They can separate themselves from that individual, they can move into the basement, they can do something where their exposure stops at that point, and then they can start counting their quarantine period from from the last day of their exposure. But if you're continuing to live with an individual, you don't have a separate part of the household to live in, etc., then yeah, your quarantine period begins on the last day of their infectious, on the last day that they're infectious, which would be day 10. So your quarantine would begin on their day 10, and it would go for whatever period, ideally 14 days, 10 days, or 7 days with the test. Now, I just want to make a caveat. If you are vaccinated, so your husband is not, I don't, you didn't say husband, I'm sorry. So your household member is not vaccinated, or maybe they were and they got sick. If you are vaccinated, there is still this caveat that if you're fully vaccinated and you get exposed, you don't have to quarantine. In other words, you don't have to stay in the house and avoid working, but we are asking in those situations that you test yourself again about that day 5 or 7, that sweet spot where most people can convert, and that you wear your mask for the full 14 days. Because as we know, being fully vaccinated is not a guarantee that you're not going to get that virus is not going to replicate and shed, even asymptomatically, particularly asymptomatically. Okay, so a vaccinated individual does not necessarily have to quarantine, but a vaccinated person who's ill needs to isolate. That's been a big source of confusion for a lot of people. And I hope I was clear about that. And if not, send your question again into COVID and I'll try and respond in writing. Sometimes a lot clearer when I write things down. Did that make sense to you, Nancy?
Yes.
Okay. All right.
Um, let's see. That's it for questions. So it
Great.
is 4:15. So if you would like to
Well, wish
have any
everybody
closing
a
statements?
very Merry Christmas. I've got my elf sweater on. Everybody, enjoy the Christmas holiday. You deserve the joy and the love, but this is going to be a different holiday. It needs to be a different holiday. Please don't assume and proceed as though nothing is happening. We are staring down what could be one of our biggest surges. Whether or not the virus is more severe or less severe, a lot of people getting infected means a lot of people getting sick. And we need to keep a lid on that as much as possible. Behavior change does work. So, your mask is important. Your social distancing is important. Your hand washing and your ventilation is important. And please, if you are getting together with family, vaccinated or not, it's prudent to do a test. If you can get your hands on a test, it's prudent. Now, I do want to share. I almost forgot. We are closed. The health department during the holidays. Tomorrow and Friday will be closed, and then for the following New Year's next week, Thursday and Friday will be closed. So if you're looking to us for a test, um, you're out of luck today, probably even. You'll have to schedule it Monday, Tuesday, or Wednesday of next week. Of course, you can still go to urgent cares. You can still seek that out through pharmacies. But I just wanted to remind everyone that the health department closes um, Thursday and Friday for Christmas and Thursday and Friday for New Year's. So we won't be available for that testing, unfortunately. Did I forget something else? Oh, Facebook Live. Yes.
Yes.
So next week, because of the holiday season, and I think because of who's going to be here and who's not going to be here, our Facebook Live session for next week is going to be Tuesday at 3:30. Just so we can have one and make sure that you guys have a chance to answer your questions. And then the following week, that would be January. What day did I say that was? 6th,
6.
9th? January 6th. So starting in the new year, we'll be back to our normal time on Thursdays at 3:30, and we'll be continuing Thursdays from there on in. But we mixed it up a little bit through the holidays just so we could be available to you. So
Okay.
that's all I have.
All right. Thank you.